Looking after care home residents can be complex as they are often in and out of hospital. If they have a number of long-term conditions, this can lead to polypharmacy, being prescribed many different medicines, increasing the risk of adverse side effects. The Lewisham Integrated Medicines Optimisation Service, LIMOS, works across the hospital and care home setting to ensure that medicine use is effective and safe. LIMOS leads holistic medication reviews in the care home setting and involves the whole team, including GPs, care home staff, dietitians and above all, the resident and their relatives.
Having a LIMOS pharmacist has been extremely effective in our management of patients in the nursing home I look after. We do ward round together, joint ward rounds weekly, and we discuss each patient individually. This has been extremely effective in prescribing and sometimes de-prescribing as well. For the safety of the patient and for my own safety, I feel much safer with having the LIMOS pharmacist on board. This has improved the care and the efficacy of looking after the patients. We share the records and we share the care, and yeah, it's been magic.
Yeah, I have medicine every day to keep the pain at bay.
Do you have lots of medicines?
5. I took 5 this morning. I know I'm taking the right medicine because I'm a very inquisitive lady. I want to know what tablet is what for.
Yes.
Having the pharmacist help with this, how does that make you feel?
Oh, I feel top of the world. Yes.
The LIMOS model promotes safety through joined-up care.
I can see on the shared record you mentioned about switching to a DOAC, and you've agreed that with the GP. Okay, so that's fine. I'll speak to the ward doctors here and make the switch.
If a care home resident is admitted to hospital, LIMOS also works with the clinician and pharmacist to sort out any ongoing medicines issues where required.
So what this means is that the patient comes into the hospital and we're aware of any changes that need to be made and followed through from the care home to the hospital. That means that we liaise with the doctors on the ward and then again with the community pharmacist on discharge so that the patient is cared for safely and that any changes are communicated effectively.
LIMOS works within Lewisham homes to support staff to implement NICE guidance on managing medicines in care homes. This ensures medicines are used safely using a patient-centred approach.
The LIMOS team have been a great support to Pediatric Care Centre. They are the second eye when it comes to medicines. They help find if a medication is high risk, contraindicated in the home. They make sure that we are compliant in every aspect of the word and we're safely giving our clients the right medication. Issues such as, for example, covert medication, they make sure that we have the right paperwork in place. They make us compliant also with CQC and any safeguardings that we might have in the process. Having the LIMOS team at Pediatric Care Centre is extremely priceless.
In Lewisham, the safe transfer of care rules agreed between primary, secondary and social care ensure clear communication to reduce the risk of medicines errors when patients are admitted or discharged from hospital. LIMOS follows up all discharges in the care home setting, which means we can resolve medicine problems quickly if they do occur.
LIMOS has been really good in helping us bridge the gap between the lack of communication between community pharmacies and GP surgeries and hospitals. They've been especially helpful when it comes to changes in medication or hospital discharges, and basically keeping us as a community pharmacy in the loop regarding their medications.
Whenever we have a discharge from hospital, in the past we always have a problem, but since we have the LIMOS team coming out, knowing that we are not a nurse, they will come out and help us to make sure that the discharge that we receive is safe, that the residents' medication is up to date and they're on the safe medication. They also work alongside us making sure that we store our medication in the right places. And they also work with our pharmacy, they work with our GP. And we can't do without the LIMOS team. They are so helpful that we just cannot do without them.